people in our community are drowning. I talk to people all around the world. The levels of disparity and anxiety and hopelessness is just a pervasive issue across the board.
All of us are one bad day away from a mental health crisis. And so for individuals who have finally reached that point in their life, it can be scary.
We see those that come to our healthcare system asking for support for behavioral health needs. Community health has to include behavioral health services.
It's a systems issue, and it's not only going to impact that individual, but it's going to impact that individual's friends, their family, their workplace. When we're not able to address it early on, it continues to grow until unfortunately it kind of hits this boiling point.
Montana has one of the highest rates of addiction and significant mental health issues in the entire country. To keep our communities healthy, Bozeman Health is going to play the most integral role in helping our community.
When we started to think about behavioral health services and the needs of our community, we were pretty pragmatic about the fact that this was not going to be an easy lift. In many cases, it's almost as if we were designing and building a brand new healthcare system for the community of Bozeman and beyond. And so we recognized that we couldn't do it alone. So we did begin conversations years ago with our community to say, what are the needs? How are resources deployed, and how can Bozeman Health come into this situation and really provide benefit?
This past summer, we were asked by the board to put together essentially an entire continuum of care. The complete continuum is important to behavioral health care because people enter into the continuum at all the different points. We are looking at reaching out into our schools and our community to help reduce stigma and to increase people's awareness of what is out there for help. Also in prevention, but also starting towards treatment, is integrated behavioral health. And that's where we have social workers or counselors embedded into our primary care offices.
They can see somebody same day or get an appointment fairly quickly as well. And it's coming as usually a warm handoff or directly referred from their primary care provider who they already have an established relationship with.
Next in the continuum is outpatient or specialty care. An outpatient clinic is for someone who may have more chronic illness or maybe have treatment resistant and need just a little bit more intensive care. The next piece of the continuum is crisis, and usually that's an emergency room or an acute care center that handles people in crisis.
This has not existed in our community before. And so it's really exciting to have the opportunity to have people come into the emergency department and actually provide treatment for the first time instead of just assessment and placement.
Right now we only have 2 rooms that are safe for patients who come into crisis, and this will more than double our capacity to handle patients who come into crisis. And then having inpatient for those who do need to have more inpatient care. And for those patients, it's usually when they're a danger to themselves or others or can't care for themselves in the community that they need to have inpatient care.
Our patients that come through the ED who need voluntary, involuntary commitment, we won't have to send them somewhere else. We'll have our own 12-person bed where we can take care of our own patients there in a closer proximity.
And then to complete the continuum, once they're in inpatient, then they need to be discharged into care. And so that's where outpatient comes back in again. Of once they get stabilized in the inpatient unit, being able to discharge them into a specialty clinic to get further care. I would say that the majority of the patients I see have been suffering with the mental illness for a while before they finally enter into our offices or come see us. When they realize that there is hope, just that alone is often life-changing. And then after they receive the care and they say things like, I never knew life didn't need to be that hard, or I finally see color again, or I'm feeling joy for the first time in 20 years.
Right now, that's one of the hardest things that we deal with is when we send someone to another community, we have no say in what happens to them. And so when we have that full spectrum of care here in Bozeman, it's going to empower us as providers. and not feel like we're passing the buck to another community, and that for once we're treating versus just putting a Band-Aid on it.
Patients are also going to know that I can go to Bozeman Health and it doesn't matter what level of care I'm going to need, but I'm going to get what I need.
In my wildest dreams, I never imagined that I would be able to build from scratch what we hope will be a gold standard treatment program here in Bozeman.
I love impacting systems. That's the reason I'm here, is to impact not only an individual's life and help their situation better, but knowing that that's going to impact their family members, their children, those who are around them, and then our community as a whole.
I think we will finally be able to say we have truly integrated all dimensions of health delivery for our community. I think there'll be a level of professional fulfillment and satisfaction that when somebody comes to a clinical location at Bozeman Health, that we'll be able to direct their care, coordinate their care, and deliver this love and compassion in a way that we haven't been able to accomplish in the past. And so I think it will be a great cause for celebration in the future.